Hi, welcome to my channel. My name is Colleen Louis-Jacques, and I am a practicing obstetrician gynecologist with over 31 years experience in the field. So I believe that makes me an expert in women's healthcare. But I'm also a regular physician, and today is Transformation Tuesday. I would like to discuss a pet peeve that many physicians have. Primarily, we are blamed for poor health. We are blamed for not being talkative enough. We're blamed for not discussing details with the patient. Well, when you walk into a doctor's office and you're given bad news, it is very hard to pay attention to what it is because bad news hurts. It kind of stops you on your track. But before you leave the office, or maybe after you've left the office, you can also make a point of saying, okay, this is a little shocking. Can I get back to you? Can we talk about this? Because at this moment, I can't hear what you're saying. And that's okay too, because that is your health and you need to make it clear that it may not be at a good time to talk to you about what you need to do. But at some point, you do have the responsibility to go back and to speak to your doctor or nurse practitioner or midwife, whoever you spoke with, because providers come in many forms. So you speak to your provider and say, hey, I didn't quite understand what you said to me. Let's go over that again. And you need to have a clear understanding of what the problem is, because it's only when you know exactly what is wrong can you then discuss a game plan. The doctor is responsible to give you the result and discuss to you what it all means, but the doctor is also responsible to help you take the necessary steps to get better, to solve the problem or improve your health. And if it's something that is not treatable, at least be able to explain to you why it's not treatable, especially if it's bad news, like cancer. If the physician is unable to help you figure out a game plan, that person is also responsible to then refer you to an authoritative figure that can then discuss with you some of the steps you need to improve your health. At no point should you ever feel that you cannot get the answers that you need, because you are the customer. You are paying us to help you manage your health problems because we are the expert at it. If the doctor or provider cannot help you and they cannot refer you, guess what? It's time for you to find another physician. I like to believe that I take good care of my patients by explaining in a language that they can understand all the issues that they have. Keep in mind, doctors are generally smart people, right? We have to be smart to some extent, but it doesn't mean we have a heart. You do need to find a physician that has the heart to care about you as a person, to see you as a mother, a father, a daughter, a son, a brother, a sister. They have to see your humanity in order to help you. And if that physician cannot do that for you, time for you to check out. Time for you to cancel out that physician and find yourself another one. What I don't like is when people seem to think that all doctors are the same. No, we're not. Just like not every actor is a good actor, right? Not everyone is good at what they do, but it's your health. You need to make sure you understand what is going on. So for Transformation Tuesday, what I want you to understand is that it is the doctor's responsibility to explain to you what is going on, but it is also your responsibility, because you're responsible to yourself to understand what is wrong, what it is that you need to do to fix it, and what the potential outcome for you will be. Then you start making plan and you start taking the necessary steps. You start developing good habits. So let's say, for example, the doctor said, you know, you have diabetes, Mrs. Jones. Well, Mrs. Jones has to understand what the risk factors were, what she can do about to fix the diabetes, and what the complications and long-term benefits are to do what is good to change the outcome for her, or the potential complications that can incur if she doesn't do what is recommended. It's not unusual for people not to make changes because habits are difficult to change. Remember, it's the bad habit that you had that brought you to the point where you are. But you don't need to stay there. You can change your bad habits for better habits, and then you can take necessary steps. And these habits become something you have to practice on every single day. If it seems to be overwhelming for you, then you do one step at a time. So you cannot lose 30 pounds in a day, correct? So what do you do? So the first thing you do is you go home, look at your cabinets, look in your refrigerator. You know what's not good for you. You know what's bad. You can make those decisions. The problem is you can't make those decisions every single day and stick to them. So that is most people's problem. But if you have a problem that needs to be changed, unless you change the old habits that got you to a point where your health deteriorated, you're not going to change anything. And that's what we call insanity, correct? You do the same bad things over and over again, and somehow you think you're going to wake up 30 pounds lighter, diabetes is gone, cholesterol is not normal, and your blood pressure is in normal range. And we all know that's not true. It doesn't happen that way. You need to make changes every single day. And you can start small. So the first step might be, okay, I love to eat a lot of bread. So you know what? I am going to cut down my bread. If I can eliminate the bread, so maybe I'll cut it down to a slice or two. Or better yet, maybe I'll switch to a lower calorie bread so that I can still feel as if I'm eating the bread. So baby steps. You don't exercise, and that, will help you. But keep in mind, exercise is not going outside and running a marathon. Exercise could be putting on music and dancing for 10-15 minutes. It could be going up and down your stairs 4 or 5 times a day, several times up and down the steps. So you start taking baby steps. Go around the block once. Then you do a second block, then a third block. And then before you know it, you're walking half a mile. And if you can do half a mile, you can do a mile. You need to put the effort in. I have no problem spending time, even calling patients back or texting them or having them come to see me a second or third time if I feel they're motivated. Human beings love to feel needed, right? Doctors are no different. So if you show that you care about what's going on with you, we are right there with you. And if your physician is not there, remember, if your physician doesn't have the heart to treat you, then you do owe it to yourself to find someone else. There are many providers out there. You just need to connect with the right one. And if you can't find one, you can call your insurance company. They can help you. You can rely on your friends. And this is the time that you rely on friends. People rely on friends and family for solving medical problems or discussing health issues and taking their word as the gospel. No, there's a limit to what your friends can tell you. Your physician is always the best person to reach out to. But if your provider is not there and you need to get a second opinion or a third opinion, it is your right and your prerogative to do so, because you only have one body to take care of. And you need to understand that. Change can only come if you make the change. You keep doing the same thing over and over again, yeah, you're going to get the same result and you're going to be right back or even worse. I had this one lady, for years I've been telling her, she had risk factors, family health history, as well as personal health problems. She was overweight, she wasn't exercising, she had a desk job, and she wasn't moving much. So we went over several visits, several years of discussing her risk of developing diabetes and high blood pressure. And one time she came to see me. She was on medication for high blood pressure and for high cholesterol. And she was miserable. She was having all kinds of problems, joint pain from the cholesterol medication. And so I said to her, well, what have you done since you were told you had this problem, since the medications are not working? And she stopped and stared at me like, are you blaming me for these problems? I'm like, well, some is hereditary and some is lifestyle. So one of the things that can help you is to improve your lifestyle. Well, this is not going to happen. And I don't want to discuss this. I thought it was a bad idea to bring it up, so I don't want to talk about it. So she clammed up and stopped talking. So the rest of the visit was kind of awkward and uncomfortable, but we got through it, and I never saw her again. So it wasn't because I did not care. I cared too much for her. It's just that she wasn't willing to do the work. So don't blame your physicians for why things are not happening. If your doctor advised you to lose weight but doesn't give you a few steps of how to do it, then you need to check out. If you have high cholesterol, you're not told how to lower it. You shouldn't be just given medication. You should be given lifestyle choices. And that is very difficult. And this is what patients don't really like to hear. You do need to make lifestyle choices. Medications cannot change your lifelong history of things that you've been doing to yourself that have been destructive. Medication cannot revert the past. You cannot go back, and the drugs cannot take your body back to the place it was when you were 15 and 16 or 20. Bad habits catch up with you. So the question is, what are you going to do about it? And this is Dr. Louise Jacques on Transformation Tuesday. I'll see you next time. Have a great day. Always remember, that choice is yours.